Gastrointestinal stromal tumors are actually the mesenchymal in origin, and it's very difficult to differentiate between a benign and a malignant one, even with the histopathological findings. And most of the time, they have high levels of CKD11, and most of the time, the part of the GIT tract which is involved in the gastrointestinal tumor is stomach. Although they can be anywhere, or they can be in a pancreas as well, but most of the time the stomach is involved, and the patient can present to you with, again, the same signs and symptoms: anemia, hematomasis, melena, weight loss, and there is a possibility that maybe possible they were isolated stromal tumor in the stomach, or there may be some other associated tumors in anywhere in the body. So you can see here, actually, these are the gastrointestinal stromal tumors, and you can see the large tumors which are coming from mesenchymal in origin or connective tissue. So this is another diagram which is actually, this is a diffuse, mostly a diffuse part or type, and this is the mostly the polypoid kind of a lesion in that. And you can see this is the whole of the tumor. This is the basement membrane, and then there's the lamina propria, and these are the epithelium. Okay, so if you could see, the most of the part of the tumor, almost whole of the part of the tumor, is contributed by the mesenchymal origin. Like, this is the connective tissue, and there's a hypoplastic changes and malignant changes in this stromal part of the intestine. Okay, so these tumors they're not responsive to the chemotherapy, they're not responsive to the radiotherapy. So the only option for the GIT just tumors is the surgical resection, and obviously that depends upon which part of the stomach is involved in a greater curvature or a lesser curvature, and you plan accordingly. If you have to go for a sleeve gastrectomy, or you have to go for gastrectomy with pyloroplasty involving the pylorus part of the stomach. So it entirely depends upon the condition. And then obviously CT would be, triple contrast CT would be very much important, giving you information about the location and if there is any signs of metastasis in this particular disease compared to the just tumors. So we talk about the benign and malignant tumors of the small intestine. We talk about the benign tumors like lipomas and hematomas, and we talk about the neurological tumors like neurofibromas. Remember, these gastrointestinal tumors are more common in the background of neurofibromatosis, right? And we talk about the malignant tumors as well. We talk about the adenocarcinomas and carcinoid tumors, and we talk about the lymphomas and gastrointestinal tumors. Although these tumors are rare in small intestine, malignant especially, less than almost 10%. But if you encounter such tumors, then either you go for a palliative therapy, or you go for curative therapy. If a primary tumor is present, then you have to go for a curative. There's no evidence of the metastatic disease, then you have to go for a curative treatment. But in case of the lymphomas, most of the time you have to go for the palliative treatment. So that's all for today's lecture. Thank you for watching sqadia.com.